Hi, everyone. My name is Robin Landsey, and I'm so excited to welcome you to our Centering Community Voices in Implementation Science, Community Engaged Research through Partnership, Trust, and Shared Learning. And I would love to invite my two co-hosts for today, Larry Cowan and Jean Hernandez, to say hello and introduce themselves.
Hi, everybody. Jean Hernandez. I'm the Executive Director for el Centro de Acceso para Latinos de Alabama, o Alabama Latino Access Center.
Awesome. Larry?
Good afternoon, everyone. I am Larry Cowan. I am the Executive Director of Selma Air, based in Selma, Alabama.
Awesome. Well, thank you. So we are excited to be here, and we have a full packed an agenda for today. And so I'll first share our agenda, and then we'll do a quick poll to take a pulse on who is here. So we're going to begin with going over just very briefly what is community engaged implementation science, and I'm going to go over some of the kind of academic ishness of community engagement, all of the in, over, under, around sort of things about dissemination, implementation, and translational sciences. And then it'll be fun to hear from Jean Hernandez and Larry Cowan, who just introduced themselves, on their perspectives on what trust, partnership, and shared leadership look like in practice. And then we will have some fun talking about an exciting new thing that we're launching called Community Cafe. And it's really an example of centering community voices and came out of a retreat that we had and that they voiced that they would like to have. And then we'll end with some collaborative planning and discussion, and hopefully have a lot of time for conversation. Okay, so we're going to take a quick little poll, and I'm going to stop sharing, and Sarah will initiate the poll so that we can all take the poll real quickly. Thank you. Okay.
Okay.
Yeah. Sarah, are we ready to end the poll, you think? Or I guess I can end it maybe. Okay. Let's see here. I think I can share the results. Oh, it says that another poll has started or shared.
Robin, I'm also sharing the results.
Oh, okay, good. Good. Okay, so it looks like out of the 29 responses, 26 of them said research, and we have 4 clinical practice, 4 community organization or partner, and 2 person with lived experience, and 3 other. And obviously it's you can pick multiple there. Alrighty, and then what is your level of experience with implementation science? About half, 55%, said somewhat familiar, and 28% experienced, 14% or 4 out of 29 new, little or no experience, and 1 who's advanced. Who is that advanced person? And then level of community engaged implementation science. Again, about half somewhat familiar, kind of paralleling what we had, but no one advanced expert. Okay, so we'll stop sharing, and hopefully my notifications don't keep showing. I'm not real sure how to turn that off, so I'm sorry about that. Maybe I'll figure that out shortly, but okay. Let's see. Show from the current slide. All right, are you seeing the right screen, my agenda the correct way?
Yes.
Okay, good. Alrighty, so I'm just going to be very brief. We want to hear from our stars. So most of us in sort of the implementation science world hear a lot about these numbers, but just want to kind of put it into perspective here for all of us. 17 years of discovery to clinical practice is what the literature shows of what we are looking at currently, and less than 14% of those evidence-based interventions actually reaching practice, and a little less than a third of patients receiving evidence-aligned care. And what we do know is that the community context, whether it's dealing with the uptake, how it fits, what the trust is from the community, how it's delivered, and what those factors are that's driving whether or not people have access or using it. As a behavioral scientist, I think about behaviors and what drives behaviors. And so there's a lot of factors that come into play, and the context should not be the last step, as it is truly a part of the science. There was a recent publication this year out where it shared that 80% of the research that's purported to look at dissemination implementation science research, that there's really 80% of them have sort of this superficial description of what engagement is, so not really digging into describing what it is, and only 16% of them measuring the grants, measuring engagement in a meaningful way. So I would say that the gap is not interest, but more the rigor in how we're measuring it and describing it. And so hopefully we can dig a little bit more into that. And when we talk about community engaged dissemination implementation science, really what we're looking at is how we take those evidence-based interventions that the research has, and looking at how they're communicated, whether they're adopted, adapted, if they're successfully implemented, and then sustained. But working with our community partners, patients, families, practitioners, others who are have knowledge and engaging with as scientific partners from the conception of what the research questions are, or driving what needs to be the questions, all the way through the process, and having these feedback loops. And often we've looked at, sort of the research being done to communities or for communities versus with the communities, and that's really where we are sitting here. And we do know that community engagement can affect what, as I was saying, what gets studied, measured, found, and whether those findings are adopted in the end. And so helping determine and define what the research questions are. We do know that sort of sustained engagement builds that trust infrastructure that's, we know in this context, required to reach and retain populations with the highest HIV burden. And with our community partners, if we're able to partner together and with our outcome selection, identifying what would be acceptable, feasible, what would be a good fit. And that high quality engagement does predict implementation fidelity and sustainment, and that there are validated instruments that exist to help us measure them. Another really important finding, and what is in the literature, is that community engaged studies showing that if community engagement is a big part of it, is that those follow-up rates above 80%, where if we did not have that, it would be much less. Here's just a very brief sort of roadmap for what it would look like across time to be able to have community engagement as part of the implementation science process. And we have a really fun short clip that will show, but Larry has a nice call to action on involving the community early on and engaging before the aims and measures of recruitment. And so here is a slide that kind of walks us through how we can, at each of the stages of implementation science, engage with our community and helping define whether it's the implementation strategies and how they might fit a specific setting of people, places, routines, helping to identify barriers and facilitators, and then sort of what we think of as precision implementation, or matching those strategies to the barriers. And again, looking at measuring what matters and planning for the sustainment. And we're so fortunate to have our co-leadership with our community and at our CFAR, as well as with our hub, and improving both the science and the practice. And this is just a nod to when we were in our first phase of having a hub, partnering with our community and developing webinars. And these two were with Yale, and where we looked at community engagement and sort of what does it look like from engagement to empowerment, and invited our community colleagues and partners to lead the discussion on that and drive the discussion, and was really thankful to have them partnering on that. And so now we're really thrilled to be working in this space and this phase of our hub with Larry and Jean as our community experts and leaders, and guiding really what we do with our hub with this multi-layered co-leadership. And
I'm Larry Cowan.
I'm Jean Hernandez.
We are bringing you Community Cafe, which is a series that is brought to you by the UAB HIV Implementation Science Hub.
We're going to have a series of podcasts, and we're going to come to you.
This is to bridge the gap between researchers and community.
It means that we're not going to be in an office, we're going to the community, and we're going to do collaborations with community and researchers, and we're going to be lifting the voices of the community related with research.
love that. So excited.
I'm Larry Cowan.
I'm Jean Hernandez.
Excited to pass this on to both Jean and Larry Cowan. Jean, again, is the Executive Director of CALA, and Larry Cowan is the CEO of Selma Air. And we'll invite them to now share their perspectives on trust, partnership, and shared leadership, and what community engaged implementation science looks like in practice from two people who live it every day. So thank you.
Hey, Robin, can you get the other slide?
Can you see my, sorry, let's see. Is it not sharing?
Should be.
Did you want me to? Yeah, okay.
Yeah. And so thank you, Robin. And you see that podcast is part of the initiative that when research meets community, and we create a podcast. And it's been amazing. And that podcast, Larry, I know that he will talk more about it, where we are very proud to, put our experience, our lived experience, into research, make it fun. Why not, right? And using the media, right? Sometimes we are more traditional when we are being around this time, doing the webinars, but no, now people require that we are not going to be an hour, 2 hours. People require 5 minutes or 10 minutes or 3 minutes, right? But still, we can educate people and get to the people. Can we go to the next slide, please? And Larry, if you want to say something.
I think so far you're hitting the nail on the head. So I am not going to stop you. I'm going to let you handle it as you best can.
Okay. So that's my partner in crime. So trust is where partnership begins. And I'm gonna tell you that this happens again and again and again. It's not about only trust, it's about a relationship. Okay. And I think all the networks, coalition, cohorts that I'm doing is because it's a trusting relationship. It's been developed through the years. And I know that I can go in a space where I've been seen, heard, but also our community is welcome. That matters too. And very quickly, there's a survey that they did in 2021. This is from Pew Research. And they asked, to the specific Hispanic population, what would be the most unwelcoming profession to Latino people? Guess what? The number one, it was scientists. They feel that they're unwelcoming. And I put you out there that because sometimes it's important that we don't see it as the perspective of the researchers that I'm trying to do the best, right? And you can go to a community and you can say, I think we can find the cure to cancer. But if they don't trust you, but look at this. The most trusted profession through the Hispanic or Latino people are musicians. So that means, this is a joke for you here. So that means that Bad Bunny have more credibility than researchers. And that's so funny because they probably will hear Bad Bunny saying a message, about research that a researcher. And professional athletes is the second one. So now that the football is going on, if you get Messi in your research, you're going to get people, okay? Then medical doctors. So those are the three most, and because people is through culture, right? And that's important. So I just wanted to make you laugh a little bit, but also 70% of the US workforce, right, are Hispanic, but only 8% are working in science or in technology or engineering. So that's a gap. So we need to recruit and empower more minority students, not only Latinos, immigrants in general, so they can be on board. So you can mentorship and you can develop those partnerships.
Next slide, please. So how trust is built. And building trust is not a one size fit all, and it's not, as it says, it's built over time. The relationship is like a courtship and not speed dating. And I will say I am going to show my age a little bit because in the generations that we see now, everyone wants the quick, fast, and in a hurry, or the wham, bam, thank you, ma'am. When it comes to building trust, you have to get to know the person or the people, the community. You have to take time to develop that. So you literally have to court them. You have to have them in at the beginning. You have to have them listening with you before any decisions are made. You can't make a decision without them and think they're going to trust you. You have to have them along from the beginning of the process. any commitments that you make, any promises that you give, you have to follow through with them. And if you can't, be honest about that and let them know why. Don't just say, I can't do it and not give them an answer, because then the trust that you've developed has now been eroded. Be honest about any challenges that you're facing, but also listen to any challenges that they are facing. Because sometimes the people that you want in the room may not be able to be in the room when you want them to, due to family issues, work issues, children issues. But if you work with them to discuss those challenges, you can create an environment where when there are challenges, you can discuss them, figure out how to adapt, and move past them. Respect lived experience. No one's story is going to be exactly what you want. You have to be able to listen, understand, and respect the fact that their lived experience is their lived experience. You have to be able to glean what you need from that, but you cannot disrespect their lived experience at all. And stay in communication from the beginning to the end and even after that, because sometimes just being communicative will keep those doors open, even if it's not for research. Just calling and say, or emailing and saying, hey, how's your day going? You came across my mind, just wanted to check in on you. Those are the things that you use to build trust. And in the next slide, we have a teaser for our podcast. Oh, I'm sorry. Never mind. Jean, you.
That's fine. It's okay. This is part of community. You see, we are like that. We are not like, so. All right. So why trust matters in implementation? Okay. And I know that we've been talking about trust, right? But when you see problem solving, faster adaptation, lasting program, I don't see it like that. I just see it, for me, it's translated in between how challenges or problems or health public, things that are affecting our community can become opportunities. How we can help you guys, how we can resolve the situation, right? And when you put in a room people that they feel safe to share their concerns, they feel that they've been heard, they're offering their ideas, they working together as a problem solving, those programs are going to last, and not only to be heard, it's like invested in the process, right? Our voices matter, and that's ownership, right? You are bringing ownership to a community, to people living with HIV, to, people that are going through health problems, and they're part of the solution, right? And briefly, I was part of a cohort. That's why it's so important that webinars, education, that you invested in to educate people in the community. Sometimes you think, oh my God, maybe this is not going to end. Yes, it is. Invest in community. Even if you think it's not a conference, a seminary, a little presentation, it works. Even if you have 20 people, you have only one interested, is one that is going to be invested. So I was part of a cohort with the University of Houston, and it was about language justice and the intersection, right, with access to healthcare and HIV. And believe me, it opened my eyes, even though this is what I do every day, but it opened it to educate me more and to be part of the solution. And when you include funding to that, we did a survey to over, I think it was 32 individuals living with HIV and LGBTQ. And after that, we did the survey, but I don't have all the infrastructure time to put an executive summary, scientific, and the infographics. I'm not that tech savvy. No. Well, there was a great professor at UAB that have the Master of Social Work students, and they do that for free. Thank you, Donald, wherever you are. And they did a fantastic job, and 97% of the people that we surveyed says that they want to receive their healthcare in Spanish. It's important in people in Alabama to hear that. It is important. 58 always need interpretation. 66 almost always need translation of medical documents because they don't understand. And 62 have missed medical appointments due to the lack of interpretation services. So what is a need and a barrier to our community, it could be an opportunity for better linkage to treatment to a community that is not being heard. And that's what trust matter in the implementation. So thank you, Larry.
So what each brings to the table. Community organizations can bring trusting relationships because they've already developed them with community. They've been in the community, they've done the work, they've done the groundwork and the hard work for pretty much the entire time they've been there. They have deep knowledge of community needs, their strengths, their weaknesses, and also some of the barriers. They have experience working in the real world. They know the challenges that individuals face, the reality of maybe a mental health issue or a substance abuse issue or a issue with childcare. They have these, and we also have a long-term commitment to community's well-being. The fact that this agency has been in community for 30 plus years, we have a very well-known and a very, very well-rounded and strong relationship with community, and community knows that. What partners and researchers can bring to the table are evidence and technical expertise. There are things that are coming down the pipeline that we don't know about, that you all do know about. But we have those gateways to come into community so that you can make community aware of it and also figure out how to best work with community to achieve the greater goals and to find what this evidence and this technical expertise really looks like on real world levels. You have resources and tools for implementation. These things, again, are things that you have that community needs, but also community has things that you need. And these methods of learning what works and what doesn't work, not just for you all, but for community in general, and pretty much using your research to see how it will align with other companies or other countries or other parts of the world that may be going through the exact same thing and they don't know anything about it. So a strong partnership value forms with expertise equally. There is no single group. You have to have the full picture. You can't have one side siloed and the other side siloed. You have to have communication and a bridge across for both sides. And now, since I said it earlier, we do have the teaser for our podcast on the next slide. So, Robin.
There you go.
Hi, everybody. I'm Jean Hernandez. I'm here with Larry Cohen, and we are in Selma, Alabama, in our first podcast, Community Cafe.
And we're mainly in spaces that are either unserved or underserved. We do HIV testing, outreach, prevention, education. We take care of approximately 200 individuals that are living with HIV. As long as you're in the state of Alabama, we don't care if you're at the Mississippi, Georgia, or Florida line. If you want to come to us for care, one of the most recent is we worked with UAB, who was creating a satisfaction survey for ADPH. And they wanted community to be involved in parts of the satisfaction survey. So they asked if we could bring in some community individuals. So I worked with a couple of young ladies and set them up with our support group.
What advice you have for the researchers?
Bring in community at the beginning.
Hi, everybody. So it's weird listening to your voice, huh? But I think we went that day to Selma, Alabama, to the rural community. Robin and son and I, and before we start the podcast, we just met in this yummy place that they do barbecue. We sit down at the table and we just talk, how you doing, how everything is doing. Anne is coming from Georgia, Robin is coming from another place near Birmingham, I'm coming, everybody, but we sit down. And I think that partnership is more than consultation, right? Is sitting down on the table, just like I just said, meet people and really, it takes time to develop these relationships, and it's a shared decision. It should be authentic, okay, in a space that you can have a stronger partnership, but it's not built for them, it's built with them. And when you got a space, Larry and I suggested Robin and Anne, and say, no, let's go to the communities. So people learn, what they do. And they say, let's do it. And it's been a beautiful journey that leadership, HIV, and research have merged. And we can see that this initiative could last for a long time. And we already have in mind a lot of people that we want to interview. So we're going to be on the road, or we're going to be, interviewing different people, but we're having fun at it. And we want this initiative that is coming from the heart. And when you do meaningful things like that, you have another community, that is not, I'm just part of this network, I'm part of this leadership, I'm part of this coalition. That is important. But those relationships that you develop, is going to be for us sustainability. And right now, more than ever, that's what we need to do sustainability. In all the work that we do, on the funding that we do, and create outlets that is going to be meaningful for our communities.
I agree. And the one thing, if you notice that each bullet point ends with the word together. Partnership means togetherness. That means everything has to be done together. No one should feel like something can be done without them or without their partner if they wanted to have a meaningful partnership or develop a strong partnership. So that means community needs to be in there together with researchers from the beginning. So moving forward together, strong implementation is built on strong relationships. I think we kind of beat you all in the head with that repeatedly, just going together, 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 partnership, connection, trust. We all bring things to the table differently, importance with the importance of equal importance of expertise from the community, from researchers, from lived experience, from research evidence, and from practice-based evidence. When we work together, solutions are more relevant, implementation is stronger, and outcomes are more sustainable. That also means that with the sustainability, that also means that your initiatives will last longer, will help more people, and those effects will reach further than you will know, just because other people will see them as well.
Well, thank you both, Larry and Jean, for walking us through that. This is our fun behind the scenes of us getting our first podcast together. And you can see Jean and Larry, they're taping at the back, and Anne at the ready with her laptop and papers. And we just had so much fun, and sweet Jonah there. So just wanted to send appreciation again to our partners, and just this process that we're able to journey along with them and creating this podcast. And so we have, as part of that, wanted to let you know about our next first of all, our first podcast is on our website, and link to on our YouTube channel, which is UAB HIVIS. Everything that we have is essentially UAB HIVIS. Our LinkedIn, our YouTube, our website, and so and our email. And so we invite you to go there and see the full 15-minute podcast of Jean and Larry talking. And believe it or not, that 15 minutes and 33 seconds, I think it is, went straight through. We did a first, like, let's just kind of go through, and these are the kind of the prompts that were, discussed. But when we did it for real, they just went straight through. And it's amazing how just much joy and passion and I don't know, just energetic love that was in the space of discussion, um, and just hearing each other. So it was just I don't know, it was like a chorus going, and it was just beautiful. So excited for everyone to be able to enjoy the podcast, and looking forward to going and having the roles reversed and having Larry interview Jean at the next one in August, and we'll be posting that shortly thereafter. Um, but for now, we wanted to invite you all as here being part of this journey with us, and we'd love to hear from you. So we have a poll that Sarah is going to now launch, where it's our second poll of this. And we're going to have this run for a little bit because there are a number of questions, and we did include some open-ended questions. And so I'm just going to kind of keep talking while hopefully everyone here can start to engage with it. And the questions, I'll just let you know. The first question is, what podcast format would you be most likely to watch or listen to? And so interview. So yes, like what we just had shown with Jean and Larry, a panel discussion. So we could have a number of people, and Jean and Larry interview a panel of people. It could be storytelling, and it could be a mix of all three. So we would love to hear your thoughts and what you think about that. And then what the primary focus should be, whether it's personal lived experience stories, practical resources and how-to information, community news and events, research explained in plain language, or some combination of all of these. So please select what you think. And then the next question is on how would you prefer to access the podcast? We currently are putting it on our YouTube channel, where it's audio and video. But there are other platforms that we could certainly post it on. So would love to hear your thoughts on that as well. And then the fourth question is, what community voices would you most want featured? And the first one, as you can see here, that we have a list of 8, and we're asking that you select up to 4. The first one being people living with HIV. Next one, community organization leaders, faith leaders, community health workers, patient navigators, case managers, family members and caregivers, young adults, local health department or clinic partners, researchers and academic partners. Then the 5th question is, what is one question or topic you would like for us to explore on the podcast? And we would love for you to just write in any thoughts that you might have as a question or a topic. And if there is a specific person or organization that you would like us to have featured. And feel free to write yourself in, but we recognize that would then make it not anonymous for you. So we welcome you to reach out to us at uabhivis@uab.edu is our email. Again, and you could private message us on the chat here as well. So we welcome that. And then another optional short form, short answer question, anything else you would like to share. So I think we'll keep that running. while we go on, so that you all have as much time as possible to answer the questions and move throughout that. Jean or Anne and Larry, is there anything that I missed a point about for the poll, or Sarah, as you posted it?
I don't think you missed anything. I think you pretty much very eloquently went through everything in pretty quick fashion.
I am known to talk pretty fast there,
Thank
so
you
thank you.
for this opportunity. I think Cypher and all the staff have been wonderful just to create a space so we can do this, and I'm looking forward to many projects and adventures and more barbecue.
Yes, and more barbecue. Well, I will for now stop sharing my screen and open this up for discussion and audience questions. And we'll just keep the poll going. And wondered if Larry or Jean, if you had any questions that you were thinking, oh, I should have brought this up, or an invitation from the audience here to either just unmute, ask your question, or put in the chat, or feel free to DM us and we could ask it anonymously for you in this process of what we've shared. Oh, I see. Yes, Vincent.
Yeah, thank you for this wonderful opportunity to hear about community involvement in implementation science. I'm in Botswana, and implementation science and even community involvement are not very big. So I'm just wondering if there are opportunities of collaborating with African researchers in starting this kind of work in Botswana and other places that don't have FM, IS, and community engagement culture.
I would say we are a very collaborative group, hopefully that is coming across. And there probably as many people as you talk to here as different, thoughts and areas of opportunities. So I will invite the group here, whoever might want to share some things that they might have. And Anne, as our hub director too, may have some thoughts that she would want to share. But I think that one way that we are happy to always engage is to just reach out to us through either email or on our website. Sarah might be able to put into the chat quicker than I can say it, but a link to our website. And we do have for everyone, we would welcome scheduling free consultations that we offer to the community at large for our hub, and things that we can share with you. Of course, it needs to be the focus here, but happy to discuss that with you and discuss with you what we have here.
Thank you.
Yeah. I see Jules' hand raised.
Hi, can you hear me?
Yeah.
Hi, so this is Jules Levin. I'm the executive director of NATAP, the National AIDS Treatment Advocacy Project, based in New York City. I don't know if you know who I am, but I've been working on HIV for 25 plus years. I founded NATAP 25 years ago. It's the largest HIV organization in the world. Our website gets 6 million hits a month. We do webinars for up to 1,000 registrants. Every year, we do multiple webinars, including webinars on aging. I've been working with researchers for 20 years. I'm in the ACTG. I've worked with Anne over the years and the NIH and the OAR. I've been recommending implementation research to the NIH and the OAR for aging and HIV for a number of years now. And in New York City, I worked with Einstein CFAR in designing and implementing what I call an implementation research study, where we provided during COVID online support groups for older women of color with HIV over 60, Black and Latino women. It was very successful. It hasn't been followed up on. My point is, though, is that I just wanted to mention that I think aging and HIV has been neglected. It doesn't get the attention it needs, and it's a perfect opportunity to utilize implementation research. And I'll just give you one example. The guidelines, HHS guidelines, and several other key guidelines in HIV all recommend certain screenings for older people with HIV, which most community advocates know nothing about. They don't know that people over 50 are supposed to get a screening for bone mineral density. They're supposed to get a frailty screening, and they're supposed to be evaluated for cognitive impairment. And most clinicians are not doing this. I think this would be a perfect opportunity for an implementation study to look into this and why it's not being done and how to implement this. And I'll end with that.
Well, thank you so much. I see that Anne
Yeah.
unmuted, but I
Just wanted to say hi to Jules. Good to see you here. And I've been doing my job here and trying to promote HIV and aging research with a lot of the young investigators that we've worked with. So a couple have put in some projects for that. So thank you for coming to our webinar today.
Yes, I echo that. And Jules, we're always looking to discuss and share and look at ways to collaborate. So happy to, even look at time outside of this to discuss. And so thank you for bringing that up. And definitely, we've, as Anne said, been discussing the aging population and the needs and how we might be able to be in that space. So thank you. And would our community experts, Jean or Larry, want to share any about work that y'all might be doing in that space as well, or things that you know about?
Well, I definitely want to thank Jules for speaking about HIV and aging as someone that is 17 plus years lived experience and getting older on the opposite side of mid-40s, heading towards 50. It is something that has not only come across my mind, but it's something that I've discussed and have heard discussions about at other meetings. So there are things that are going on as far as that. If there are opportunities for individuals to bring this to researchers' minds or either to discuss it further, especially in areas, metropolitan areas of New York, but also in the rural areas of the South, like here, those screenings are needed across the board, but also the health disparities and issues that are going along with that from different areas also need to be looked at as well.
Thank you, Larry. Thank you. Jean, did you? Yeah.
Yes, I just agree with Larry and Jules. There's a lot of things that are evolving, in HIV, and the community doesn't know. And it's important that we use these platforms, to talk with the community and understand that, science evolves, we have now injectables, now we have regimens that are going to go from 6 months to maybe 1 month, and there's people's life involved, and we need to make it a priority. So yeah.
Thank you. Jules, did you, I see your hand raised again?
Yeah, I just wanted to respond to Larry. He raised an important point that I think is something you might want to look at and
Mhm.
consider. Here where I'm based in New York City, which is obviously a very urban area like LA or Chicago, it's much different than in a rural area like many areas in Europe, down in your geographic area, and in the South, where it's very rural. So I think one of the key questions as we move into right now, 50% of people in the U.S. with HIV are over 50, but within 5 to 7 years, it's expected 70% will be over 50. And the CDC predicts by 2040, 75% will be over 65. So we're heading towards an era where all HIV clinics are going to have to incorporate geriatrics into their clinic, geriatric assessments and geriatric care. But when you're in a rural area, it's very hard to bring people in for those kind of assessments because they have such a long way to go. So I think that it would be a great opportunity in your area to look at how do you incorporate geriatric assessments in a rural area, whether it be telehealth or home visits. There are ways to maybe address that. It's something for you guys to think about.
Thank you.
Uh,
Thank you.
Thank you, Jules. And believe it or not, those are things that have already been in discussion because the agency that I work for, we have predominantly an older clientele. As I will say, it's probably mixed 50-50 now, especially with the younger generation. But the older generation, that is something that we've had to work on doing as far as creating kind of like a hybrid way of doing it where it is offered via telehealth through our clinic, but also the case managers go out and do home visits and assess if there are needs or if there are barriers that have not been discussed or that are not being met that we can probably work on as well. So I do thank you for that. I appreciate that. And the work is being done. It may not be highlighted in as much as it needs to be, but I think we are starting to get on that part here in the South, and maybe that's something we all need to do as a country is put the focus on not just the newly diagnosed and the younger generation, but the aging population as well.
Yeah, and I would say too, another point to this is what a great topic for our one of our next podcasts. And certainly the invitation is to help guide our topics for discussions and who might want to be on our podcast. So, Jules, there's that. I as we're coming to a close, I would like to just remind everyone that we have in the chat, I think it's still in the chat, a link to our second poll, which is the invitation to provide your thoughts and guidance on our podcast journey as we're going to go on, and Community Cafes podcast. And then also we really would love to hear from you as well as feedback on our survey or seminar, and so that we can look at that. I think there was maybe a couple of slides that I still had, and Jean and Larry or Anne, if there's anything that I am not remembering, please let me know. So I just checked the slides and we'll be posting those. The only remaining one was a set of resources, and those will be posted with our slides as well as the recording. So please be on the lookout on our website. Again, it's UAB HIVIS. And there's a link there where it says events, and on events, you can click on that and it will take you to the recordings. And Sarah is so wonderful to get these uploaded really quickly. So by tomorrow, we'll have the presentation recording, as well as the slides posted, as well as some additional resources that we'll have related to this area. And so we welcome you to come there. Also, we have coming up in 2 weeks on Wednesday, I guess it's August 5th, we will be having our conversation hour. So we'll continue the conversation about this and other aspects of interest to anyone who joins about community engaged implementation science, our podcast. And if anyone would like to just really jump on, it's more of a time to just jump in. It's come as you are. There's no preparation. And it's a fun time to be able to have some more individualized discussion. So it is posted on our website, but noon Central, 1 Eastern, August 5th. So please be on the lookout for that. And if you are not already on our listserv, we would love to add you to our listserv. And there should have been a prompt for that when you registered. So with that, just want to thank everyone. And again, just really so appreciate Larry and Jean for all of their just continuous. I overnight was trying to count up the number of times that we have met since our time with Renee Heffron, our MPI as well for this. And when we had our strategic planning retreat, November 14th, back in last year, and to now, and how many times we've had meetings and planning sessions and all of that. So it's been fun getting ready for this, and the journey is only just beginning. So we're super stoked for that. So we hope you all have a wonderful rest of your day, and thank you all for joining us.